This video is one of a sequence of videos on veneer placement on maxillary anterior teeth. And the other videos in this sequence are in the video library of dentistrymasterclasses.com. Everything related to veneers, as well as many other comprehensive cases and all the Dental Minute videos. So hit the blue link in the description below and subscribe to dentistrymasterclasses.com. This particular video is on provisionalization of 4 maxillary anterior teeth that have been prepared for veneers. These are the provisionals. So we start with the wax up model, and you can refer to the video in Dentistry Master Classes on how to prep stone model for a wax up. And what we're doing, you can see this is a little bit thicker and it's the ideal length. And we use that to fabricate the matrix. We're fabricating the matrix here on this waxed up model, and we'll use that for the provisionals of the prepared veneer teeth. Mark the midline so you don't get lost when you're placing it on the teeth. So this is the inner part of the matrix. And now we've already prepared the teeth. We're squirting this Luxatemp, which is bisacrylate. You don't want to use acrylic anymore. Use bisacrylate because it doesn't heat and it doesn't shrink. Now when you're placing this in the matrix, you can see I've also prepped 2 teeth for crowns over here, but we're talking about the provisionals on the teeth that have been veneered. Be sure you keep the tip of the gun rubbing the bottom of the matrix so you don't incorporate air bubbles. Keep the tip at the bottom of this, the incisal part of the matrix, and just rub it against it to break the surface tension so you don't incorporate air bubbles. Wet the teeth, soppy wet, just as wet as you can get them, and leave them wet. Then squirt the bisacrylate on the teeth. These are 2 crowns over here, and we're squirting it in between the teeth. Then you're seating the matrix. Now it's very important that this matrix extend onto the palate. Why? If you don't extend it onto the palate and you push right here, it may push too far and you won't capture the tooth correctly. You can push on the molar teeth, but you want this to extend onto the palate. Then you can push right there in the anterior and it will seat ideally. Squirt this little blob of material on the napkin on the patient's neck, and then you can gauge when it's set. Let it go ahead and set completely, and then just wiggle it out. There are my veneers and my crowns. And tease it out of there. Bisacrylate's very durable. I'm trimming the excess with scissors. Then I'm trying them back in. Remove the bisacrylate that may have stuck between the teeth. Then this is just a 2-sided diamond disc, and I use that for the initial trimming. You want to be careful using an acrylic burr because it'll grab it and break it. I'd rather use that 2-sided disc or a high-speed handpiece most of the time. Mark the interproximal contacts. You just be sure you have this going full speed if you're using an acrylic burr, because they tend to grab and it'll throw it and break it. So light touch and full speed. These are the 2 crowns that I'm cutting, trimming the provisionals. This is just a long shank round burr on the palatal surface, and then this is a thin carbide acrylic burr. High speed, light touch. Go in the polishing direction, not the cutting direction of the handpiece. Then trying them in. Then you can use this flame-shaped diamond, perfecting the margins. Don't touch the teeth, just the margins. Check with articulating paper. And now if there's a lot of anatomy inside, these are the crown preps, a lot of anatomy in there, take this long shank round burr and remove some of it so it doesn't impede the seating of the crowns. Bisacrylate's very accurate, so you don't have to worry much about that. So seating of the veneers, you use Scotch Bond or some other adhesive without primer, not primer adhesive, just adhesive. And I wipe the teeth off. You don't etch them. Just wipe it off and then squirt the adhesive into the provisional veneers and push them to place. Wipe some of this on the facial surface. It acts as a glaze. Now I've got 2x2s behind the provisionals, and I'm blowing the excess adhesive off the veneers onto the 2x2. Don't just blow it into the mouth, blow it onto the 2x2. And I'll blow it from the facial and the palatal. Now I'm seating the crowns. All right, once I've blown the excess adhesive off the veneer provisionals, come back with a curing light. This is a Dimetron curing light, and I cure each veneer provisional 20 seconds on the facial and 20 seconds on the palatal surface, holding them to place with my finger while we're curing them. Then this is a wonderful way to perfect the palatal or the lingual surface of the veneer provisionals. It's just a show-fu gray polishing wheel, and it'll cut the provisional material, but it won't cut the tooth. So it's just perfect for getting a nice margin on the palatal surface. Be sure the wheel is spinning from the provisional to the tooth. You don't want it to spin from the tooth to the provisional and just go all the way across. That's the dental minute, and these techniques work, and they work every time.